Are you concerned about the risk brought on by the lack of integration in your security products, as well as the lack of monitoring in your environment of those products? If so, you're not alone. Hi, I'm Josh Lanier. I'm a Microsoft Solution Principal at Critical Start, who powers Spyglass MDR. Today, I'd like to talk to you about reducing risk through platforms as well as people, both looking at integrations and why customers are moving toward a platform approach, as well as looking at managed XDR to monitor those systems. When we look at the platform approach, what is it solving for? In today's environment, we see healthcare customers are overwhelmed with alerts and anomalies coming from a myriad of tools protecting identities, endpoints, email collaboration, and applications. There's mapping challenges in threats as they move across the kill chain. While attackers can quickly traverse rapidly across the enterprise, defenders are working in silos across multiple products, leading to alert fatigue and increased risk. This was realized in a recent Gartner study survey showing that 75% of organizations are pursuing security vendor consolidation to reduce that risk. Now, what does that platform approach look like when we look at the Microsoft 365 platform, and how can MDR help when we couple an MDR provider with that security platform? If we look at a simple use case for Spyglass MDR, we look that and see a typical user, in this case, in our healthcare setting, it might be a physician or a nurse clicking on that bad link at 3 a.m. to start of their shift. That user opens a malicious email attachment that might have gotten through, and then that attacker uses that user account through a password spray account. They start using that credential. With the Microsoft ecosystem, we can see that Defender for Office 365, which provides collaboration protection, not just for email, but also for Teams, we see that sharing signal with Microsoft Defender for Endpoint, the EDR solution. For the identity, I see Azure Active Directory identity protection, as well as Defender for Identity, bringing all of these attack signals together. And with Spyglass MDR consolidating that signal and acting to contain that threat and to remediate that threat. When we look at Spyglass MDR as a platform alongside Microsoft Security Platform, we can see here on the left, you see the 365 Defender investment that customers are making when they move to that platform approach, coupled with Critical Start, which is providing a platform that contains cyber research. It contains a zero trust analytics platform, which can help you reduce alerts from the Microsoft security stack by more than 99%. You're also getting Critical Start analysts, but we'll get to that when we talk about people. Pair that with Spyglass's security and compliance services, and you have a complete story that can help you mitigate risk from a platform approach. Now, when we look at Spyglass MDR, that's going to contain cyber operations, risk, and response. Now, what this contains is we're helping reduce risk by providing a real-time SLA and performance reports, as well as custom playbooks to complement the Microsoft stack. Now, let's talk about people. Now, when we look at people, hiring remains a challenge in healthcare. In this study conducted by HIMSS, you find here that recruiting qualified cybersecurity staff was one of the top hiring challenges faced by the cybersecurity field. Couple that with insufficient budget and lack of qualified candidates and non-competitive compensation, and we can see that our cybersecurity staffing is still at risk. We've seen this as well at Critical Start. With Critical Start and Spyglass MDR, we've helped customers mitigate these concerns. Let's look at a customer profile. This was a healthcare provider with over 5,000 employees and 6,500 endpoints. They had some of those, and they had some of those same pain points that we see in the industry. They had limited security resources, they had difficulty acquiring talent, and they needed 24/7 monitoring. They didn't have a SOC. They didn't have staff that were monitoring their Microsoft security platform investment 24/7. They wanted to make sure that investment was fully operationalized as well. They didn't just want to buy the platform and use one piece of it. They also had a reactive security posture and wanted to be more proactive. With Spyglass MDR, they were able to achieve the outcomes of immediately getting a security operations center, engineering, and threat intelligence resources provided by Critical Start, and also 24/7, 365 coverage across multiple products within their Microsoft 365 investment. They were able to resolve 100% of alerts in their environment, and that allowed them to shift their focus toward proactive controls in their environment. Now, what did that look like? When we look at the Critical Start SOC, it provides 24/7, 365 monitoring. It provides contractual SLAs for time to detect and time to respond. Each analyst is required to go through 8 weeks and 300 plus hours of training when they are onboarded to the Security Operations Center. We're also meet PCI DSS and SOC 2 certifications for our SOC, as well as having a greater than 90% employee retention rate. And not only that, we provide 40 to 80 hours of continuous training on Microsoft security products to make sure that our analysts are trained and staying up to speed on the latest in the Microsoft security portfolio. This provides that desired end state to where you can reduce risk by resolving every alert, reduce time to detect and respond, increase SOC efficiency, and also prove that return on investment that you made by moving to a Microsoft platform. Thanks for watching this video. I hope it helps as you consider looking at a platform for your healthcare organization, as well as a partner to manage that investment. Have a great day.